Judge rejects FTC effort to block health system merger. A federal judge ruled on Tuesday that the merger of two large Illinois hospital systems could proceed despite the efforts by the Federal Trade Commission to block it. The decision represents a significant setback in the agency's continuing attempts to police the industry during a flurry of deal-making among hospitals and physician groups. Without explaining his reasoning, the judge, Jorge L. Alfonso, denied the agency's request for a preliminary injunction to block the proposed merger of Advocate Health Care, the state's largest health system, and North Shore University Health System. His decision will be made public after the parties have the opportunity to redact sensitive competitive information. The case was heard in the Federal District Court for the Northern District of Illinois, Eastern Division. Last December, the FTC sought to prevent the merger, arguing that the 16-hospital system would dominate the North Shore area of Chicago. Federal officials said the combination could result in people there paying higher prices for medical care and receiving lower quality care. But the hospitals justified the merger by pointing to the major changes occurring in health care, including health systems being held more accountable for the overall cost of care for their patients. Hospital executives said the proposed merger was in keeping with the federal government's goal of promoting alliances among hospitals and doctors so they could better coordinate care and improve quality while reducing prices. Without the judge's reasoning, it was unclear exactly how damaging the decision would be to related cases the agency is pursuing. But the decision raised hopes among advocates for the spate of mergers that it will result in more courts ruling in their favor, accepting their argument that the combinations were being encouraged by the Affordable Care Act, known informally as Obamacare. "I really believe this case was precedent-setting," Mark R. Neiman, president and chief executive of North Shore, said in an interview. "It really reflects the first time a decision is grounded in the realities of the Affordable Care Act." Federal officials said they had not decided whether they would appeal the judge's decision. "The court's ruling is disappointing, and we will be considering our options," Debbie Feinstein, director of the FTC's Bureau of Competition, said in an emailed statement. A spokeswoman for the agency declined further comment. If the merger takes place, the combined systems will serve more than 3 million patients a year and will be the 11th largest nonprofit health system in the United States, according to the hospitals. The agency's challenge to the Advocate North deal was its third attempt in recent months to stop a proposed hospital merger. The FTC took similar action to halt the merger of two hospitals in West Virginia last November and joined state authorities to try to halt a deal in Pennsylvania in last December. The agency's willingness to try to stop these deals came off a winning streak for the FTC, said Lissel Dunlop, a partner and antitrust expert for Maddett, Phelps, and Phillips, a law firm in New York. While hospitals were arguing that the federal health care law was forcing them to combine, the courts were ruling that the ACA made me do it was not a defense.